Many times the oncologist and the patient develop a very close bond, and it's a very personal relationship over many, many years sometimes.
Patients from CCS Oncology are confused and worried after the FBI takes over local offices. Good evening to you. Agents raided several of the Western New York locations.
That's right. All this centers around some serious financial troubles here.
Yeah, patients going in today, they received this letter. It advises them to check out other treatment centers.
And those that rely on CCS, as you can imagine, have more questions than answers tonight. If you are a patient now, what are your options? And what about the employees there? Here's 7 Eyewitness News reporter Ed Riley with the answers you're looking for.
We've been with them so long, and then for them to pull us through this is not fair.
Last year, we introduced you to breast cancer survivor Jane Hurlbert. She was at CCS Oncology in Orchard Park to be checked by its medical director, Dr. Juan Samyi. At the time, Jane was upset because she had to find new health insurance because Independent Health was dropping CCS from its coverage.
No sense whatsoever. I mean, the doctors are great doctors.
When news broke today that FBI agents were searching CCS offices, we again talked with Jane.
It just keeps you rattled all the time, keeps your nerves up. You don't know if you go or you don't go or what you got to do.
Patients are being given a letter explaining that the government was taking steps to get information for an ongoing investigation involving Bank of America, which received court approval to seize CCS Oncology assets.
You can't keep jumping from doctor to doctor all the time. I've been with these doctors for 2.5 years, and now I've got to change.
A lawyer for CCS said it would be open tomorrow and will continue to provide cancer care.
The suspicion is that there is very likely a criminal investigation into potential Medicare fraud or billing irregularities.
We also talked with 7 Eyewitness News legal analyst Florina Altschiller.
It certainly suggests that there are darker times ahead for this facility.
The Western New York medical community is watching the developments closely, and experts at Roswell Park said steps are being taken to help patients who need to find a new oncologist.
I think the most important message is that the remaining oncology providers in Western New York are ready to take care of these patients, and they just need to kind of keep a clear head and pick up the phone and call whoever they think is the right person to call.
The U.S. Department of Justice said it is copying certain information that's in possession of CCS Oncology, but it's also telling patients that their medical records will remain in the offices. In Orchard Park, Ed Riley, 7 Eyewitness News.
And new tonight, partners Catholic Health, Buffalo Medical Group, and Roswell Park are now working together in response to multiple calls, as you can imagine, to each organization from patients who have been instructed to seek care or who are now looking for alternative providers or cancer treatment services can call. This is an important number here, 716-706-2100 between the hours of 8 a.m. and 5 p.m. A call center representative will help concerned patients by providing options for where to go to ensure the continuity of their cancer care that they are receiving or to access to primary care services. That number, once again, on your screen, 716-706-2100.